Fibroids are a very common condition that we don't understand very much about, and a registry is one way to collect information from lots of women to help them understand what the best choices are for their condition. The main mission of Compare UF right now is to have women who are scheduled to get treatments at the participating centers tell their stories with these forms and numbers. In the registry, we ask women to give us information about their past medical history, about how the fibroids are affecting their lives in a number of ways. And we do that in a way that turns those answers into numbers. And by using those numbers, we can compare the results and how can we help patients and doctors make better decisions in the future about which treatment is better for which woman.
When women think about fibroids, I think some of the top things that they want to know are, how can I feel better? How can I stop this condition from completely monopolizing my life? How can I get my life back? Women want to know what treatment options there are out there, and they want to be able to understand those treatment options.
There's several benefits of registry data. First is an opportunity to enroll participants at baseline, meaning prior to any treatment, medical or surgical intervention, to see how they're doing before we intervene for care. It then offers the opportunity to follow women over time, whether that be 6 months, whether that be 1 year, whether that be 2 years. The Compare registry is following women up to 2 years post-treatment, so it's an extraordinary opportunity to use that data. The other important aspect of a registry is that it improves access to a broader range of women to participate. If women were to ask me, well, why participate in a registry? I would say, well, it means you don't have to necessarily be affiliated with a certain clinical program or a clinical health system. You have the opportunity to invest in your own care by participating actively in research.
Compare UF is a really groundbreaking study because it has involved patients during every step of the research process. I started the Fibroid Foundation 11 years ago after my second of 4 surgeries. And my work with Compare is very much a part of my experience as a patient. I found that there was a void of information and treatment options and caregivers. And so I started talking with women about their fibroid experience and found that the fibroids community is enormous. In fact, the statistics really just blew me away, with 80% of African American women having fibroids and up to 70% of all women being diagnosed at some point in their lifetime.
Compare UF has been different from other registries based on the idea of gathering or capturing a patient experience. So I think when you're working on the other studies where you're just kind of stating the question and they're giving you the answer based on the options that they have, versus Compare UF where the patients really want to go in depth and explain and give an experience of what they've been through and how they're feeling now.
I've heard lots of positive stories from patients who have participated in Compare UF. We have women who are able to go back to their daily living without the fear of having bleeding or being in pain or just having any symptoms that are affecting them from their uterine fibroids. We have women who are able to conceive who were in fear of not being able to beforehand. And we have women that are just relieved that they no longer have to deal with the effects of uterine fibroids.
One of the things that makes Compare UF unique is the involvement of patients in finding the research questions, in helping us design the study, and helping us interpret the results. This is a very exciting time for fibroids research. There are a number of new treatments becoming available, both in terms of procedures, and there are a number of drugs that are very close to being approved. Compare UF can help answer a number of questions about real-world effectiveness of all these treatments and can ultimately help make women with this very common condition healthier and lead to better outcomes for them.